We are here.
Good afternoon.
Good afternoon.
Welcome to this important discussion on homelessness and housing. As the chair of Subcommittee 4, which oversees housing, this hearing will be the opening to our discussions on housing that will continue throughout the budget process. Sub 4 will examine the entire spectrum of housing, particularly what to do about affordable housing, farm worker housing, multifamily housing, and homelessness housing. And we'll work with all stakeholders to craft an approach that best leverages any available one-time funding the legislature may approve. Our agenda today focuses on homelessness. I'm particularly interested in learning about what the locals are doing in their communities. And a little later, we're going to have the opportunity to introduce some of the folks that are here from Los Angeles as one place, but my colleagues will then introduce some of the folks from their areas as well. And with that, I'm privileged to be co-hosting this event with my two colleagues, Mr. Assemblymember Thurman and Assemblymember Chu, who are from the Bay Area and have similar concerns given the density, given the lack of resources from the state, and the growing epidemic of issues surrounding homelessness. So with that, thank you all for being here, and look forward to a lively conversation.
Good afternoon, and thank you to Mr. Chairman and Mr. Chairman to this opportunity for us to be together. You don't have to tell anybody in California or in our nation how critical the conversation around homelessness is. And this is an issue that we know cuts across every single community in California. And it is for that reason that I want to thank my co-chairs today for doing this meeting. It's an issue that certainly will come up in Sub 4, and I'm honored that we have the chair of housing here as well. We know that in every facet of the conversation, it will come up. Last year in Sub 1, we had our own conversation about homelessness from the standpoint of two viewpoints, and that is one, foster youth. And we spent a significant amount of time talking about foster youth and other homeless youth, and actually advocated a proposal for money in the budget to support a program called Transitional Housing Plus. Ultimately, that proposal didn't make it to the final step. But one did, and we talked about homelessness from the standpoint of a CalWorks program to provide support and rapid rehousing, and that program was funded at the tune of several $1 million, which we're very proud of. We know that we must do more and more and more, and that's why I'm excited to join these colleagues and the members of our subcommittee. I want to thank all of you who are here, all those who will testify, and all the folks on our staff, and then just say that in my 20-year career as a social worker, most of it with foster youth and runaway youth, there's no issue that I've seen with more intensity than the lack of stable housing. And we know that in almost any sector where we serve, if you don't have stability in your home, you don't have support, it is hard to be successful in life or in any other way. So I look forward to what we can learn through this informational hearing, and I look forward, more importantly, to the work that we can do here in the Assembly to support Californians who are homeless and their families. Thank you.
I also want to echo my colleagues on this topic today. And it's a testament to how important it is that we have three committees that had all planned to do their own hearings on homelessness coming together to at least kick off a discussion collectively. And I also want to just take a moment and acknowledge the vice chair of our housing committee, Mr. Steinnorth, for his participation. And each of you who are in this room, thank you for your work on homelessness. From my perspective, this is one of the most important moral issues of our day. Some of you have heard me talk about the affordable housing crisis that our state is experiencing. The fact that California has the highest poverty rate in the country when you include housing costs. Homelessness is the daily, painful manifestations of those challenges. In San Francisco, while there are a number of areas where we have led from embracing the first housing model to moving forward with the one-stop shop known as our navigation center, Our recent homeless count showed that we had close to 7,000 people on our city streets that did not have a place to live. It's my hope during this hearing that we will talk about the very human costs of homelessness, the cost to local and state governments of not housing people, the fact that if you are homeless, you're much more likely to access the most costly healthcare services, that if you're homeless, you're much more likely to spend time in jail or prison at tremendous costs to our communities. And I also want to point out that our state assembly has been a leader in the area of homelessness policy for the past decade. And we can talk about all the policies that we've moved forward, but part of why we're here today is to talk about what more we can do. And it is my hope that this year we'll be able to move forward not only in the budgetary context of thinking about how we can invest more smartly in ending homelessness. But I do hope that from these conversations, we will continue to innovate and think of smart policies that we can move forward legislatively that complement our investments so that hopefully someday we can say that in California we turned the tide when it came to homelessness. Thank you so much.
Thank you for joining, Mr. Steinworth. If you have some words.
I appreciate it. Thank you. It's a privilege to be here with the three chairs. It's not a singing group. It is something that I find very valuable for us to be here today to talk about homelessness. I represent the inland communities. It's different than some of the coastal and the urban that we have represented in our chairs, but I represent the city of San Bernardino, which in the Inland Empire, we have a tremendous problem with homelessness as well. And it's something where we have a lot of land. We're not impacted the same way, but coming up with a process by which we can really turn the housing units that are available into a available space for us to be able to house people is something that I think all of us are working towards. It's not just affordable housing, it's how do we make housing affordable? And it's something I look very forward to in these conversations. Thank you.
Thank you. And Ms. Patty Lopez?
Good afternoon. I'm so happy to be here. Also, I'm representing the District 39, and I'm looking to the homeless perspective also for the mental health. I feel like that is an area we can improve, and I look forward to find out how I can support my district and the whole state in the homeless issue.
Thank you again, Chairs Nazarian and Chair Chu, and to my colleagues who are also joining us today. In a moment, we're going to hear from Senator Holly Mitchell, and I want to just say what an honor it is to have her joining us here in this House. Many of you know her from her work as a fierce anti-poverty advocate on issues in her district, the 30th Senate District, and throughout the state of California. While she needs no introduction, I think it's important that we acknowledge her for that work, including the work that she does on our parallel committee on Health and Human Services in the Senate, Sub 3. Senator Mitchell recently had the opportunity to travel to Utah. A lot of us have been talking about the conversation about housing first. She's taking this trip to help us have a policy conversation in general between the two houses. And for some who aren't used to seeing a senator in this chamber, to me, it's important that she's here. It lifts up that our entire legislature gets the impact that this challenge is having on all California communities, and we are glad to have her partnership in conversation here today. Please join us, Senator Holly Mitchell.
Thank you very much, Mr. Chairs, plural. The unorthodox approach that you are taking in today's hearing is not lost on me, and I certainly appreciate you extending the unusual invitation to have, albeit a former member of your House, a senator, participate in an Assembly joint hearing. I won't take much of your time, but I really appreciate the opportunity. Yes, I went to Utah. Many of you said, Holly, Utah, really? It's an issue of scale, and that's true. But after going to Utah, I can come back here and say to you all unequivocally, yes, Utah, really. You will hear statistics from the rest of your really amazing panel today. Unfortunately, I won't be able to stay for the hearing because we have floor session at 2. But I do want to share with you 4 quick takeaways from my experience, an exhausting, detail-rich trip to Salt Lake City, where we met with the House Minority Leader, the Mayor of Salt Lake City, the Mayor of Salt Lake County, toured an amazing former hotel, a Holiday Inn, that has been purchased and is converted to what's now called Palmer Court, which is a 201 units of permanent supportive housing for both families and singles. Met with the employees who run the state's homeless trust fund. Met with the state director of the Department of Healthcare Services. My 4 10,000-foot takeaways, and I'd be happy to sit down with any number of you to share details with you about the trip. But my takeaways: number one, it's hard when you're California to acknowledge your own shortcomings as a state. And my takeaway, and we discussed it on the trip, is the reality that California simply does not have an integrated system of service or care for our homeless population. There are counties, many of you represent counties that are doing some great things. There are some counties who need additional support, but statewide we do not have an integrated system. My major takeaway from the Utah experience in talking with these elected leaders that I shared with you was it was amazing to me, and I've never had a similar experience in California, where 3 levels of government, separate meetings, were all singing the same song. The commitment was consistent. The challenges were consistent. These were bipartisan meetings. The most appropriate resolution was consistent. I've never seen multiple layers of government all clear about what role they need to play individually and collectively to solve a problem. And let's be clear, Salt Lake City, Utah, has reduced their chronic homeless population over the last 10-year period by 90%. They still have homeless. It's not as if there are no homeless people in Utah, but a 90% reduction, I think, is significant. And what the county mayor shared with me as I talked about my observation of this common language is that what that reality has done for all of them as political and elected leaders, it's led them to believe that the problem is solvable. We often find in these halls where we can kind of throw up our hands, we think about poverty, we get overwhelmed. How can we even begin to make a significant dent? The residents of Utah are clear that there's a significant reduction, and so it gives them the political will and courage to tackle the next leg of their challenge. That sounds rather sophomoric, but when you think about it in our own context as policymakers, here in the building, when we go back to our districts, to be able to show with a 10-year evaluation that they have reduced it by 90% gives them the force behind them to really take this next major leap, which the county is now spearheading with their state legislature. Secondly, again from the county mayor, he's clear, based on their experience in Utah, that housing first is a better taxpayer option and a better option for all of the residents for the state of California. He was quite eloquent in his rationale for that. There will very likely be some debates in this legislature whether housing first is an appropriate theory around addressing our homeless population. But I'm clear from the Utah model that housing first is the best, most humane, most appropriate use of public dollars to support our homeless community. My colleague here from LA County, who will be testifying in a following hearing, also made another observation as we talked about the realities of how we score savings and what we then do with it. And the savings associated with moving people into permanent supportive housing must be, we have to figure it out, colleagues, reinvested in the ongoing support services that they will need. I think when people hear housing first, they assume that it doesn't include the appropriate support services to guarantee that people will be successful in their transition. And that's not what I mean when I use the term, and that's not what I saw in Utah. I think the challenge is we spend so much time talking about the front-end dollars to invest in expanding the housing stock. What often doesn't get discussed, nor is it adequately funded, is the ongoing social supports that are critical for this population to be successful in their transition from homelessness to housing. And so figuring out how we redirect those dollars, which are often categorical, so it won't be easy, but how we guarantee that those dollars saved, which for LA County is tens of thousands, hundreds of thousands of dollars per year per homeless individual. If we can transition them from the unhoused to the housed, how we recapture those dollars associated with our jails, our prisons, probations, Caltrans, all of those public dollars that are now being used in a non-efficient way back into programs and supports that can keep folks housed. So Utah is well on its way in a very, in my opinion, progressive way in terms of addressing not only the key determinants of homelessness, but also coming up with both short-term and long-term solutions that will help them keep their chronic homeless population low. I'm proud to be a member of this House, a member of the Senate, where the Senate has, as you all know, announced our No Place Like Home model, which is the funding element. The Assembly will do the same, but I really hope that we can work collectively as leaders in our communities, recognizing that all of us, regardless of the districts we represent, have a chronic issue in our home counties, and look at all of these models, both Utah, LA, San Francisco, to figure out what we can build and expand to scale so the state continues to have a meaningful, relevant role to play. This is not just the local issues that we shouldn't simply be looking to our cities and counties to figure out. The state needs to put our shoulder to the grindstone too. So again, the culture shift, if we can make significant difference this legislative and budget year to prove to ourselves and these advocates behind us that it is a solvable problem, I think it will go a long way for all of us. With that, Mr. Chair, thank you for the opportunity. If there are any questions, I'll be happy to field them.
Thank you, Senator Mitchell. I look to my co-chairs to see if there are any questions for Senator Mitchell. You.
I just want to say briefly, I know you've got floor session starting in 3 minutes, but this is probably a 3-hour conversation, and I very much appreciate you reaching out to us to have this conversation. I'll just say from my perspective, I think what you have talked about are all things that I've heard from advocates are something we should do around integration, around the efficiency of using budgetary resources, about reinvesting in supportive and wraparound services. And yet we can't do it. It's been a very difficult thing. And so I'm not going to try to ask you to give us your blueprint of how we would get there in the next 2 minutes, but if you have any high-level thoughts on what you think we need to do first and foremost to get closer to what you saw in Utah.
I think, quite frankly, that we have a perfect storm from my perspective. I represent a city and county who have passed resolutions making major investments. My city has a new committee on homelessness chaired by Councilman Marquise Harris Dawson. All of you have examples of that across the state. The fact that both of our houses have made significant commitments in both the budget context as well as policy bills, I think is the first step. I think if we continue to have the conversation, we continue to look at models that work and figure out how to ramp them up to scale, that we are committed to each other to think outside of the box. In terms of redirecting savings back into programs, that's going to mean blowing up some silos and looking at categorical funding in a very different way. I think if we all collectively have the courage to step up and address this public health, public safety issue around basic humanity, then we'll get there. I think that it would be naive of us to think that we're going to solve it all in the second calendar year of a 2-year session. And so I'm hoping that the leadership of both houses makes a long-term commitment to get it done. The first Utah piece of legislation that created their statewide oversight council was passed in 1986. And they were very honest on our trip in terms of documenting where they fell short and the ways in which and the causes that led them to kind of pick up momentum. We looked at their 10-year evaluation. This isn't a quick fix. This is something that we're going to have to be committed to fiscally and in terms of policy priority over time. And I look forward to having a deeper conversation with all of you so I can give you the names of these elected leaders and give you my full book report.
Chairman Nazarian, did you have something?
No, I'm good.
We understand that the Senate calls, and so we'll allow you to leave us, but thank you for what you shared, and we'll look forward to the ongoing conversation about how California can be the leader. We'll learn from Utah, but California leads, and we have to find a way to lead on this issue. Thank you so much.
And thanks for the invitation today. I appreciate it.
Thank you.
very appropriately, as the senator was talking about the investments that LA County and LA City have made, I'd like to introduce the next two speakers together. We have Phil Ansel and Miguel Santana joining us. Just as brief comments on both of them. Mr. Ansel was appointed director of the county's homeless initiative effective last August 2015, when he temporarily left his position as the chief deputy director of the Department of Public Social Services. And during his 19 years with DPSS, Phil played a key role in the design and implementation of numerous programs and services for homeless families and individuals, including a key role in the development of the county's homeless prevention initiative of 2005 and 6. Mr. Santana is the city administrative officer for the city of Los Angeles. And as the CAO, his office has direct oversight over the city's $8+ billion budget. Labor negotiations, debt management, and major policy issues as directed by the mayor and the city council. And it's a pleasure having you, especially Mr. Santana, because I've had an opportunity to work with you in City Hall for several years, and so it's a pleasure to have you both. Thank you for joining us. Just as a quick onset, one of the important things to me about this discussion and conversation was that we're fortunate enough to be having these conversations about how to look at investing one-time monies that we potentially are going to be fortunate enough to have in this year. Now, moving forward, one-time money is comparable to bonds raising money for capital improvements. And at the crux of it is the trust of the constituency and the voters' confidence that the projects are going to be carried through. So above and beyond just the investment in shelter, to me, especially as a very critical role, is what the ongoing costs of the wraparound service is going to be. So I'm pleased that you're here to talk a little bit more specifically about those programs that the local agencies are going to have a vital role in playing. Thank you.
Good afternoon. Thank you, Mr. Chairman and members. I'm delighted to be here. I'm Phil Ansel. I'm the director of the Los Angeles County Homeless Initiative. On August 17th of last year, the Board of Supervisors launched the Homeless Initiative to take advantage of a historic opportunity to combat homelessness throughout Los Angeles County. And our initial charge was to develop a coordinated set of recommended strategies for consideration by the Board of Supervisors, and that happened 2 weeks ago on February 9th, where a set of 47 strategies across 6 categories were unanimously approved by the Board of Supervisors. We undertook an historic, inclusive, and collaborative planning process that brought together 25 Los Angeles County departments, 30 cities, and over 100 community organizations in a very extensive planning process. And you see on this slide detailed the steps here: 18 policy summits, standing room only community meeting of 500 people who gathered together to comment and provide their input on the draft strategies, which, as I mentioned, were approved 2 weeks ago by the Board of Supervisors unanimously. There were 4 hours of public comment. Every public comment was in support of the recommended strategies, and they included elected officials from over 20 of the cities in the county. Our strategies are divided into 6 areas because homelessness is a uniquely complex problem that must be addressed in a multifaceted way. Prevent homelessness, because it's not enough to help people who are currently homeless exit homelessness into permanent housing, but we need to take action to stem the tide of families and individuals into homelessness. Subsidized housing, because the vast majority of homeless families and individuals today do not have enough money to pay for their own cost of rent. Increase income, because most homeless families and individuals do have the ability to have the capacity to pay their own rent in the future if they get the housing and related services they need now. Case management and services, because though housing and subsidized rent is fundamental, it's not sufficient. And virtually everyone who's homeless needs some level of case management and services for some period of time in order to effectively transition into and retain permanent housing. Creating a coordinated system because we have a vast, complex set of programs and services that touch homeless families and individuals, but they do not function together in a coordinated manner. And finally, increase the supply of affordable and homeless housing because it is that shortage which is a fundamental contributor to our crisis of homelessness. Now, our strategies are animated by 4 key principles. First, collaboration between the county, cities, and community partners. None of us can do this alone. Investing in proven strategies, seamless client-centered services, and I want to take another moment to talk about the importance of mainstream health, social services, and criminal justice. The vast majority of the services that homeless families and single adults receive are not from the homeless service system at all. They're from mainstream systems. In fiscal year 14-15, Los Angeles County spent $965 million, nearly $1 billion, on services in health, social services, and criminal justice for known homeless single adults. And the bulk of that was in the health and mental health system. So leveraging those systems to both prevent homelessness at the front end and to help people exit homelessness at the back end is fundamental. Now, of our 47 strategies, 12 are designated as phase 1 strategies, which we intend to implement by June 30 of 2016, less than 4 months from now, or a little over 4 months from now. And of these strategies, in the interest of time, I won't talk about all 12, but I would like to talk about 5 where we've identified a potential role for the state to contribute. So the first I want to talk about is providing subsidized housing to homeless disabled individuals pursuing SSI. SSI, of course, is a primarily federal with a state supplement, an ongoing cash benefit that enables disabled people to pay for housing, nearly $900 a month now in California. We are committing county general fund dollars to that. We are inviting cities to join with us. And the state could be very helpful if you would use one-time state dollars as an incentive for counties and cities as a match to provide housing subsidies for homeless disabled individuals pursuing SSI. One thing that's really attractive about this is that through a mechanism known as interim assistance reimbursement, the county today and the state in the future, if the state contributed to this, can actually recover the cost of those rental subsidies from the retroactive SSI check received by the disabled individual. So essentially a one-time investment can become an ongoing investment because those funds are reimbursed and then used to pay for subsidized housing for an additional disabled person. Secondly, we're investing over a third of our $100 million in one-time county funding, which our board approved 2 weeks ago, in rapid rehousing, which is time-limited housing subsidies for adults who have a good chance of being able to pay their own rent after 6 to 12 months of subsidized housing, typically through employment. The state could facilitate the implementation and expansion of rapid rehousing by contributing one-time or ongoing state funding as a match to cities and counties who contribute their own funds for rapid rehousing. Similarly, we're committing local dollars for bridge housing because the sad reality is that a significant percentage of people who become homeless when they leave public institutions that provide somewhere for them to sleep. County jails, state prisons, the foster care system, juvenile probation, hospitals, and the U.S. military. We have an opportunity to prevent people from being discharged into homelessness if we can provide bridge housing for 1 to 3 months for those individuals who would otherwise be homeless upon exiting an institution, and particularly given the state's major role as a direct administrator of the state prison system and as a primary funder in various ways of hospitals, foster care, juvenile probation, and county jails. The state could very much contribute to preventing these discharges into homelessness by providing matching funds for counties and cities that pay for bridge housing for those individuals. Our next priority strategy is an attempt to creatively utilize federal housing subsidies through the Section 8 or Housing Choice Voucher Program through the U.S. Department of Housing and Urban Development to pay for permanent supportive housing for chronically homeless individuals. 2 weeks ago, the Los Angeles County Board of Supervisors voted to commit 35% of the housing choice vouchers that are administered by the county and which become available through routine turnover to chronically homeless individuals for permanent supportive housing in the coming fiscal year, and 50% of the vouchers that become available every year thereafter. If the other 18 housing authorities in Los Angeles County, which are controlled by cities, because the county only controls about a quarter of the Section 8 vouchers in the county, if the other 18 housing authorities followed our lead and joined the county, we could generate 2,000 new units, not the construction side, but rental subsidies for 2,000 units of permanent supportive housing for chronically homeless individuals. Over 5 years, that would close 65% of the gap we have, which I'll get to in a moment, in the number of permanent supportive housing units in Los Angeles County. Now, that's for the HUD vouchers will cover the rental subsidies, but we still need dollars to cover the service costs. So the state's role here could be to incentivize public housing authorities to follow the county's lead here and dedicate a portion of their turnover Section 8 vouchers, the 4% or so of vouchers that routinely become available every year, to dedicate those for chronically homeless families and individuals by using state dollars to pay for a portion of the cost of those ongoing services. Here you see 3 more of our Phase 1 strategies, which I won't go to in detail. I would identify the last one on this slide, first responders training and decriminalization, where we'll be bringing together law enforcement agencies and other first responders across all the cities in Los Angeles County on a shared approach to interacting with homeless individuals on the street and in encampments. And then finally, we intend to enhance our emergency shelter system to enable it to be a more effective platform for access to the broad array of homeless services by enabling those shelters to be available 24 hours a day, 7 days a week, rather than only during nighttime hours, which is currently the case. The state could assist counties and cities around the state in utilizing their emergency shelter system in this manner by providing matching funds to help counties and cities make this transition. Now, cities are a very important partner here, very important partner. The city of Los Angeles, as you'll hear from Miguel shortly, was centrally involved in this planning process. Every one of our 18 policy summits, the city was centrally involved in many of the strategies adopted by the Los Angeles City Council on February 9th, at the same time that the Board of Supervisors was adopting our plan, correspond very closely to the county strategies. But it wasn't only Los Angeles City. There were about 30 cities in Los Angeles County who participate in our planning process, and we'll be hosting a summit for all 88 cities in the county at the end of March to explore in detail city contributions here in partnership with the county to combating homelessness. I'll just briefly mention 4 key opportunities that cities have. Contributing funding towards rapid rehousing in partnership with the county. I've already mentioned dedicating federal housing subsidies to combat for the chronically homeless. Ensuring that law enforcement and first responders effectively engage homeless families and individuals, and using land use policy to maximize the availability of homeless and affordable housing. In Los Angeles County, our 88 cities are responsible for 90% of the land use decisions. I'd like to close with a word about the overall cost of solving this problem and the overall size of the gap. The Los Angeles Homeless Services Authority, at our request, completed an analysis of the shortage in various categories of homeless housing in Los Angeles County by looking at our most recent homeless count from early 2015, determining what amount of various kinds of homeless housing would be needed, permanent supportive housing, rapid rehousing, so forth, based on that population, and then comparing that to the level of homeless housing we currently have, and the difference is the gap. You can see here on this slide that we have a gap of over 15,000 units in permanent supportive housing. That's where I mentioned 2/3 of that gap could be filled on the rental subsidy side if the housing authorities all committed 50% of their turnover housing choice vouchers. And you see the numbers here for rapid rehousing and other categories. Now, when we look at how much it'll cost to solve this problem, you see that there's an annual cost, excluding construction, of $429 million. But over 1/4 of that cost could be avoided through the dedication of 50% of the turnover Section 8 vouchers. So that would leave us with a net gap of about $300 million annually in Los Angeles County to get to what is known in the homeless services world as functional zero, where as people become homeless, because some people will always become homeless, that they could be moved immediately into either into interim housing, but then ultimately into permanent housing. So assuming that dedication of Section 8 vouchers, we have about a $300 million gap in Los Angeles County, excluding construction costs, and an additional cost, if we solve the problem over 5 years, of $117 million additional cost to deal with, for example, the need for more shelter and more interim housing as we move to solve the crisis that we have now. So what I'd submit to you, the takeaway message is that these are numbers that are too big for any of us to solve by ourselves, and small enough that if we work together, we can solve this problem. Thank you.
Thank you. Questions?
Thank you for that presentation. If you mind going back to your statement of key principles a couple slides back. And I want to just point out with regards to these key principles, I don't think there's anyone in this room that would disagree that these are all things that we should do. My question to you is really about the challenges of doing this. So, for example, investing in proven strategies means that you don't invest in strategies that have been less proven. We all know the challenges right now of many of our governments, cities, and counties spending in a lot of different areas, I think in areas that may not be most effective. The political challenges of pulling that money back and focusing on the things that matter. Go to the third bullet, leveraging mainstream health, social service, and criminal justice systems. We know that if you're homeless, you are likely to create thousands of dollars of additional costs when it comes to emergency health care, tens of thousands of additional costs when it comes to the criminal justice system. And yet we have trouble pulling the dollars from the healthcare system and the criminal justice system back to making sure that folks aren't homeless in the first place, that then leads to those additional costs. Could you talk about either of those situations? Like, what have you done in LA to pull money away from less proven strategies? And then what have you done to try to pull budgets from areas that reflect the impact of homelessness rather than trying to get at the root causes?
So, I mean, on the investing in proven strategies, I think there, to the extent that there is a commitment of net new resources to combat homelessness, then there's the opportunity to utilize those resources to expand or implement in a given locality proven strategies. So in our case, for example, our Board of Supervisors has approved $100 million in new one-time funding. And the single biggest portion of that, almost $40 million, is dedicated to rapid rehousing, because rapid rehousing is an evidence-based practice that, when applied to the right population, is very effective.
But if I could just ask, so I understand in LA you spend about $1 billion a year in homeless services. So of your existing services, you're not talking about redistributing how that money's used.
Okay, I was getting to that.
Great.
Okay, right. No, obviously it's easier when we're talking about net new money.
Of course.
Right. So, I mean, on the question of leveraging, I think there are two, I just want to be clear, I think there are two fairly distinct issues there. One is continuing to provide the services that we do, but doing it in a way that will produce better outcomes by ensuring, for example, that our health and mental health services are provided in a way that is appropriate for homeless adults, rather than in the same way that we provide those same services to housed adults. That's just an example. So, I mean, that's a big part of the issue here, because the bulk of the money that we currently spend inside these mainstream systems, we're going to continue spending in those big mainstream systems. But the question is doing it in a way that is more effective. Doing jail in-reach, for example, to a homeless inmate to try to ensure that they don't become homeless upon discharge. Now, on the question of redirecting dollars, there I would distinguish between redirecting within a system and redirecting across systems. Obviously, it's easier within a system than it is across. So we have a great example in Los Angeles County within a system where our Department of Health Services has been extremely committed to combating homelessness. And we have a program called Housing for Health, where the Department of Health Services has criteria. And for homeless adults who have received a certain amount of services at a certain cost from our Department of Health Services, our health department is using dollars within their own budget to pay for ongoing rental subsidies with supportive services for those individuals, based on the premise that the $1,500 a month, about $18,000 a year that it costs to provide that housing services, will be more than made up for with projected savings in healthcare costs. So that's within a system, and we have a great example of doing that in Los Angeles County. Now, when we talk about moving dollars across systems, it becomes more difficult, of course. So, for example, in the county jails, we don't have empty beds. So if we prevent homeless people from cycling in and out of jail, the effect will be that other inmates will be able to serve a bigger percentage of their term. So to realize savings from that is much more difficult, and we haven't cracked that specific nut as yet. I would say, though, that a significant portion of the costs here are actually state dollars. That $965 million that we spent in fiscal year 14-15 for no and homeless single adults in Los Angeles County were largely state dollars, for example, through the Medi-Cal program. So I think that there may be opportunities for the state to develop constructs where, if this kind of like a state level waiver program, where if a county can realize savings for the state by moving homeless families and individuals into permanent housing and capture those savings to reinvest in homeless services, the state could very much facilitate that that process of reinvesting in the way that you're describing, as well as potentially both facilitate and also stimulate similar processes at the local level.
As we take more questions, I just want to take an opportunity and welcome Mr. Cooper for joining us. Thanks for being here. Do you have any opening thoughts or comments? Questions you want to get into? All right. Any other questions?